Hi, everyone. Welcome to week 9. I hope that you had a nice spring break. We are halfway through officially, so 8 more weeks in the semester. I have several notes to go through this week based on feedback that I received from both from students and from faculty. So, general things for everybody. First, if a student is doing an instrument skill evaluation that requires discernible calculus, that is to be found by the faculty member. So the faculty member should tell the student which teeth to scale based on the presence of discernible calculus. So that might mean that you need to sit down with an explorer in order to find that. Jill put ammonia towelettes in each unit in the cabinet above the sink. So the capsules have been replaced with ammonia towelettes in case of a syncope event. The hammer with the blanket has been placed on the windowsill in the faculty office. That is something that we teach during active shooter training, that if you needed to escape very quickly, you could use that to break that window and escape the area. So it is just housed right on the windowsill. Let's see. All faculty at the end of clinic. So once the students have dismissed their patient and they are disinfecting their units, please stay on the floor and supervise the disinfection of the units. This is both for first and second year students. We have identified some issues over the past couple of weeks, and we need to make sure that rooms are being disinfected properly, everything's being wiped, lines are being flushed, and evacuation solution is being run. So please make sure you stay on the floor so you can have eyes on those procedures. And before you sign off on the quality control form that the unit has been completed, please take a look and just make sure that everything looks the way it's supposed to. Students should have the little plastic sandwich bag taped to their bracket tray to put contaminated gauze. Well, gauze that has blood and a lot of debris on it should go in that plastic bag that's taped to the bracket tray. The first year students were reminded about that this week, so please make sure that's present so we don't have contaminated gauze all over the place. And then the last thing that we shared with students is that they shouldn't be pushing trash down with their hands, gloved hands or non-gloved hands. But please just make sure that if you do see that you give the students a reminder that they are not to be doing that. All right, a couple tips as far as radiology. If you're helping a student take x-rays, a couple of things. If the patient has a really small mouth, and you're switching to a size 1 sensor for PAs, if the apices are not showing up on the first PA, second PA that you take, we need to stop that FMX and go to a pan. We can't accept periapicals that don't have the apices. So if the size 1 can't capture them, move them over to the pan room. If you have a patient that has a shallow palate, students have asked you for help, you should help them use the bisecting technique with the SNAP array to get those exposures. So please remember that method and equipment does exist. Students are instructed, if they're taking a premolar bite wing or PA, that they may need to turn their sensor slightly towards the midline at the front end of the sensor in order to capture their canine. This will still typically keep the contacts open. If that is not a technique that you are familiar with, please come to either myself or Jen Rutkowski, and we can show you what we mean by that. All right, notes for first year students. Please make sure students are following the appointment sequencing document and that they're doing their assessments in order. I've seen all sorts of things happening this past week with students perio-charting first or just going out of sequence, taking radiographs like at appointment 3. They have an actual document that details the order that they should be going. So those assessments, it should be after med history, EOIO, hard tissue chart, caries risk assessment, perio chart, perio assessment, and care plan. They should not sign up for any checks until those are completed. I neglected to mention radiographs. I apologize. Those happen after medical history is checked and the student has done a brief look in the mouth to decide what kind of RADs they're going to have. They must have RADs. If they're taking RADs that day, they must take them before they start hard tissue charting. So please make sure students are working in that sequence. To eliminate confusion, I think we're going to stop having students sign up for the DDS exam before they've completed all their assessments. So what we're noticing is sometimes they'll do EO, hard tissue chart, carries risk, try to get a DDS exam, then go do their RDH stuff. So we're going to put a stop to that because it's just sort of creating a lot of confusion. All assessments need to be completed. Once all assessments are completed, they can either ask for the DDS exam or the RDH check-in. We will be emphasizing that with students. Week 9 is what we're coming back, or where we're at now that spring break is over. And first year students are expected to be working on their time management. Please review page 30 and 31 in the purple manual in the faculty office. It lists the time management expectations. However, if there's an extenuating circumstance, like there's a lot of recession or a lot of restorative work, it's okay if the students don't exactly meet those time guidelines because there was an extenuating circumstance present. If you truly feel there was a time management issue, there is an area on daily performance where you can document that. Also, please, RDH faculty, you can help students with their instruments if they're struggling to know which working end or how to use it. Please do help them. They have skill evals coming up, and we want to make sure that they're prepared for their skill evals. So if they ask you for help, please show them how to use those instruments if they need a review or a refresher. Second year faculty, couple notes about the ultrasonics. First, if a student's using Cavitron and they need a universal tip, please use the triple bend. It is a little bit more durable, it seems, less chance of breakage bending, we think, if you'll give them a triple bend universal. There are also instruction sheets for the piezo and the Cavitron in the front of the sign out binders. If you're not sure, what power setting to use or what tips are for, you can find that there. Second year students are going to be getting mock office days. Mock office patients are checked differently than regular clinic patients. If this is new for you, if you have not participated in a mock office, or if you need a refresher, please contact Jen Rutkowski for tips. It's really important that mock office days are smooth and streamlined and that we know exactly what we are checking and how we're proceeding with those checks, how we're working with the student assistant and so forth. So if there's any confusion about that, please talk to Jen Rutkowski and she can give you the info you need. And then second year students are also starting their mock mannequin exams this week. So if there's a block in the schedule without a patient in it and you can see it's grayed out, that means that the student is doing their mock mannequin to help prepare them for CDCA. I know that was lengthy. I'm sorry. I hope you made it to the end of the video, but I wanted to make sure I shared all of that important information with you. I hope you have a really nice week and I'll see you around. Bye-bye.